Neurofibromatosis type 1 is a genetic disorder that causes neurofibromas, tumors on nerves, and skin pigmentation changes, such as flat, light brown café-au-lait spots and intertriginous freckling. It can also affect the nervous system, bones, and other parts of the body, potentially leading to learning disabilities, skeletal abnormalities, and other health issues. Key characteristics of neurofibromatosis type 1. Café-au-lait spots. These are light brown patches on the skin that can be present at birth or appear in early childhood. These harmless spots are common in many people, but having more than 6 café-au-lait spots suggests neurofibromatosis type 1. Axillary inaugural freckling. Freckles in the armpits or groin area typically develop by ages 3 to 5. Freckles are smaller than café-au-lait spots and tend to occur in clusters in skin folds. Neurofibromas. These benign, soft, pea-sized tumors usually grow in or under the skin, but can also affect internal organs. A growth that involves many nerves is called a plexiform neurofibroma. Plexiform neurofibromas, when located on the face, can cause disfigurement. Lisch nodules. These are tiny, benign bumps on the colored part of the eye, iris, that do not typically affect vision. Optic pathway gliomas. These are tumors on the nerve that connects the eye to the brain. Optic pathway glioma usually appears by age 3. It rarely appears in late childhood and among teenagers, and almost never in adults. Learning disabilities. It is common for children with neurofibromatosis type 1 to have some trouble with learning. Often there is a specific learning disability, such as trouble with reading or math. Attention deficits, hyperactivity disorder, and speech delay are also common. Skeletal abnormalities. Changes in bone development and low bone mineral density, including scoliosis, curved spine, or bowed legs. Larger than average head size. Children with neurofibromatosis type 1 tend to have a larger than average head size due to increased brain volume. Short stature. Children who have neurofibromatosis type 1 are often below average in height. A 12-year-old boy is brought by mother to the dermatologist for numerous skin lesions. Physical examination reveals 10 uniformly hyperpigmented macules, 15 to 25 mm in diameter, scattered over the patient's trunk and limbs. Freckling is present in both armpits, and dozens of soft, skin-colored domed nodules have recently appeared on the patient's back. The dermatologist notes kyphosis and refers the patient to an ophthalmologist for further evaluation. What is the most likely diagnosis? The most likely diagnosis is neurofibromatosis type 1, or von Recklinghausen disease. It is a common neurocutaneous disorder. NF1 has complete penetrance with variable expression, which means that every individual with the specific genotype will show some signs or symptoms of the condition, but the severity and specific symptoms can differ significantly among affected individuals. The diagnosis of NF1 is made on clinical criteria. Although neurofibromatosis type 2 can present with skin lesions, NF2 most commonly causes bilateral vestibular schwannomas and eye lesions, especially childhood cataracts. Tumors of the spinal cord, cranial nerves, and meninges are also common in NF2. What are the genetics of NF1? Neurofibromatosis type 1 is an autosomal dominant disorder caused by mutation in the NF1 gene found on chromosome 17. Approximately 50% of NF1 cases are familial, and the rest represent new mutations. NF1 codes for the protein neurofibromin, a GTPase activating protein that enhances the inactivation of the protein RAS. Because RAS normally promotes cell growth, neurofibromin functions as a tumor suppressor by downregulating RAS. What are the typical dermatologic findings of NF1? The hallmark finding is 6 or more hyperpigmented macules called Café-au-lait spots. In addition, neurofibromas, multiple soft fleshy tumors, usually develop during adolescence. Freckling is also present in the axilla and groin. Although NF2 often demonstrates neurofibromas, Café-au-lait spots are rare in this condition. What are the typical ophthalmologic findings of NF1? Lisch nodules, which are raised, pigmented hamartomas, are found on the iris. The hamartoma is a local malformation of an abnormal mixture of cells and tissue. Patients with NF1 are predisposed to what tumors? Optic pathway gliomas may arise anywhere along the optic tract, particularly in the optic nerve or chiasm. Patients are also at increased risk for other central nervous system tumors, such as astrocytomas and other gliomas. Peripheral neurofibromas can undergo malignant transformation into neurofibrosarcomas. What are other signs of NF1? Skeletal abnormalities such as sphenoid bone dysplasia, sphenoid bone underdeveloped or absent, dural ectasia, ballooning or widening of the dural sac, the membrane that surrounds the spinal cord, or, more commonly, focal kyphosis, an increased front-to-back curve of the spine, or scoliosis, side-to-side curve of the spine, can be seen. Weakness and reduced skeletal muscle fiber size can also be observed. Patients can also have behavioral and cognitive effects, including attention deficit hyperactivity disorder, speech delays, and math deficits. What are the treatments of NF1? There is no cure for neurofibromatosis type 1, so treatment focuses on managing its symptoms with a combination of approaches, including medications, surgery, and monitoring. Approved treatments include selumetinib, Koselugo, for plexiform neurofibromas in children, and ongoing clinical trials are exploring new drug therapies. Other treatments include surgery for tumors or bone deformities, and standard cancer therapies like chemotherapy and radiation for malignant tumors.